Hi, let's talk about data analytics in healthcare research, tools and strategies, specifically data and information governance. And we're going to talk specifically about how this relates to database management. So quality data and information. Why is there an increased demand? Well, we have a complex healthcare delivery system. There's a focus on value-based healthcare. There's the growth of patient engagement, and there's also an ever-changing regulatory environment. Why is there a need for governance? Well, there is a ton of big data when it comes to healthcare data. There seems to be nonstop breaches of personal health information. We hear about this all the time on the news. There's an increase in medical identity theft, healthcare fraud, and there's also inconsistency in how data are gathered or collected, managed, stored, whether it's in paper form or it's in electronic form, and we still continue to have issues with data integrity and lots of what we call dirty data. The purpose of governance is to proactively identify and resolve data quality issues, ensure there are well-documented and established workflows, assign responsibility for data quality to the appropriate data owners in an organization, and establish roles and responsibilities to ensure and enforce consistent data standards. The term data governance focuses on the oversight of the quality of data and establishes policies related to how it is defined, captured, structured, stored, and retrieved. Data stewards are people or representatives from a business unit or department, usually in a hospital or health insurance organization or public health agency, that are most knowledgeable and accountable about the data generated in their department. Data stewards are typically on the business side and not on the information technology side of a business. Information governance focuses on the control and use of information that is created from data and establishes policies regarding how the information is used, how it's shared, who it's shared with, when it's shared, how it can be shared, and how it can be analyzed by the organization. Information governance is considered to be interdisciplinary and works to reduce functional silos. So once again, this is not a role or committee that is solely housed in an information technology unit. The information governance framework, there's an information governance principle list for healthcare. It includes accountability, transparency, integrity, protection, compliance, availability, retention, and disposition. And so if we start with the design, we need to determine, is there truly a need to be able to collect this data? What is the meaning of the data? And we need to have requirements gathering sessions as we plan for this type of data. When we acquire data, we need to look at the methods. Are we purchasing the data? Are we curating it? We need to have guidance around this type of data. There are many different levels of data. Some are controlled by laws like HIPAA, protected health information, or personally identifiable information, also credit card information, and then sometimes we have data that may be proprietary to an organization that needs to be covered by an internal policy. Process, where do we store the data? How do we ensure that there are controls in place so only the right people at the right time have access to that data? What are the uses for that data? Many times we will need to have data use agreements because, especially in healthcare, where pieces of data may be considered de-identified when they're standalone, but when they are merged with other types of data, if there's a chance that patients could be re-identified by merging one data set with another data set, then we need to include that as part of our information lifecycle and governance. And then the disposition. How do we know when we can archive data or destroy the data? CRISP-DM has a data analytics model. It starts with data understanding, data preparation, which includes wrangling the data, profiling the data, looking to make sure if it looks normal, if there's outliers. Then data modeling, the evaluation of the data, deployment, whether that data gets put into an enterprise data warehouse or a data mart or a cube, and then also business understanding. And this is a comparison of information management to data management lifecycle. We have on the side of information management, design, acquiring, process, use, and disposition. And then over on the data management lifecycle, we have business understanding, data preparation, data modeling, and evaluation, and then deployment. So we many times use different terms, but I will say that this is not always the type of term that's used. Also, this is not always the terminology that's used in every organization, so just be aware of that. Enterprise Information Management, or EIM, I feel that this is more common, especially in healthcare, especially since the EIM model is the model that has been used by Gartner, and Gartner has partnered with many health systems to come in and transform what used to be a decision support team or a data warehouse team into a true EIM team. And so EIM is a set of managerial functions that encompasses the life cycle of data and information. EIM works with the other business units to establish policies, processes, procedures, and training to ensure quality within each phase of the life cycle. They support the use of information for decision making, describes the process for capturing and determining meaning from the clinical and administrative data, promotes the integrity of information across the life cycle. This team does this without officially being the owners of the data, because if you remember a few slides back, we have data stewards who are more representative of the data owners. The EIM team ensures compliance, and they advance the value of the information assets. And that's what this information is. It's an asset. So if there's bad data in an organization, bad decisions can be made off of that bad data. And so it's very similar to having other problems or loss of money in the organization. EIM building blocks: integrity and quality, privacy, confidentiality, and security. That is both at the physical level and the electronic level. Information design and capture, content and records management, and the information access and use. So information design and capture, we need to consider what information is needed. We do not need to capture data or information just for the sake of capturing it. What type of data is required? Does the data currently exist within the organization? Where will the data be captured, and how will the data be captured? There should be designated record sets, a legal health record. The legal health record in a health system is typically the electronic medical record. If there's a separate revenue cycle system for administrative data, then that is also considered a legal record. What about amendments and corrections, access and disclosure of that data, retention schedules, and then lastly, patient-generated health data, which in many cases has not yet been incorporated into a health organization's content and records management system, but we are getting there. Information access and use. Analytics requires policies, procedures, and processes to acquire information and prepare it for use through cleansing of the data and normalization. This includes collection, organization of the data, retrieval or getting the data out, and then doing the analysis of the data. Data normalization is a term that's typically used in database management. It includes using standardized code sets and terminologies. It ensures that data from across care settings is not redundant. it's consistent, it's logically stored, and it can be aggregated. And many times we refer to this as master data management. So there should not be 10 different names or spellings for all the different clinics in a hospital. Characteristics of data quality. We need to look at accessibility, consistency, the currency of that data, the granularity, precision, accuracy, comprehensiveness, the definition, relevancy, and timeliness. For privacy, confidentiality, and security, many times this is called cybersecurity, or this is a subset of cybersecurity. We need to look at access controls, risk assessment, mitigation planning, compliance audits, and policy. And here is an example of an information governance adoption strategy, starting with engaging sponsors and stakeholders within the organization, and then designing the governance program. That could be creating a charter, appointing a specific committee or an information governance council, kicking it off with formal committee meetings, and including things like bylaws, and then designing critical mechanisms so that all new projects or all new data requests go through this information governance committee. Recommendations can be including a vision, creating a vision, raising awareness of the value of information assets. Many times, especially in healthcare, you've got a lot of great people that are working directly with patients. They are not data people, they're not information technology people, and they may not realize the value of information, especially when that value can be impacted with bad data. Convening a steering committee, defining the governance program scope, conducting a current state assessment, developing a time frame for this new project, and then really making small incremental changes. It's important to set up policies and procedures to increase the value of the information assets and also support effective use and protection. Data analytics and governance are inseparable. Governance provides the structure to ensure the availability of trusted data to analyze in a meaningful way for sound decision making. And that sound decision making can be for anything from patient care to financial considerations. Thank you.